I'm Ed Waldman from County Sports Zone, and this is Dr. Frank Dawson, who is the medical director for sports medicine at Medstar Franklin Square Hospital. And he works with Morgan State, and he works with the Ravens, and he works with Baltimore County, and he works with Baltimore City. Mm-hmm. And so, Dr. Dawson, I know concussions are a real passion of yours. When and how did they become such a passion?
Well, one of the things that has been a big media topic in the last 5 to 10 years has been concussions, and more importantly, sports-related concussions in my field. And so when you take care of a lot of active adolescents and youth athletes, it's really important to make sure that the brain injuries are well documented and observed, and to make sure those athletes get the care they need.
So let's talk about the basics. Mm-hmm. When the trainers and the coaches and even parents are watching an athlete on the field, what should they be looking for?
Well, they want to look for any play that could possibly result in contact with the head or head trauma, and then the athlete exhibits signs or symptoms they didn't have before that play. That person needs to be removed from the activity that day and brought to see a specialist or someone who sees a lot of concussions. Even if the play wasn't witnessed to be particularly violent, or the person wasn't knocked unconscious, or there wasn't, a particularly traumatic hit, a lot of times a brain injury can result. So what you want to really be careful for is any change in symptoms after that play, and most likely it will be headache or confusion or sensitivity to light, something in that nature.
And then when an athlete is at home later that night, what should parents be looking for?
You want to look for continued complaint of headache. You want to look for any sort of confusion. Very typical sensitivities to light and sound can cause increase in the headache. Oftentimes these athletes will have neck pain or pain in the posterior region of their head where it meets the neck. Sometimes they can complain of sleep disturbances, either being more sleepy than usual or less sleepy than usual. One of the things I tell parents is you know your athlete better than any coach or trainer, so if you see something that's different from baseline, keep them out of activity till they get evaluated.
And I imagine you want to err on the side of caution.
Absolutely. The developing brain is extremely sensitive to injury, so if you have any suspicion, even if it's mild, make sure that the athlete doesn't return until they get evaluated. I tell people when it comes to brain injuries, 95%, 99% isn't okay. You need to be 100% better before you start the return to play protocol.
And to be clear, we're not just talking about football.
Right? No, not at all. I will say in my practice, I see just as many head injuries from soccer and cheerleading as I do from football. And one of the misnomers out there is that this is a football problem. I've seen concussions occur in any sport, and your contact sports are just as worrisome sometimes as your collision sports. So your basketball, your soccers, you really want to follow those people carefully.
With all the publicity that concussions have had over the last couple of years with the NFL, are we getting better at diagnosing?
Absolutely. The awareness in the public eye has gone way up, and it's really, really important to make sure that any suspicion gets evaluated, because you don't want to let anything fall through the cracks, especially in a sport when you know head contact is likely to occur again.
Is there still a macho kind of thing with concussions going on?
I think like any athlete, athletes want to be on the field, and that's one of the rewarding things about sports medicine is I'm treating a very motivated population. So sometimes with any injury, athletes tend to underreport. But one of the encouraging things right now is with all the publicity and media attention, athletes realize what the consequences are and have been much more likely than in the past to step forward.
Do you see that even with the girls and the females playing soccer or field hockey as much as with the guys who are playing football?
Absolutely. You see the incidence in girls soccer is probably the highest of all of the high school sports that we have right now in this area. So it really is something that you want people to know to look for, even if their kid's not strapping on a helmet and going on the football field.
Great. That's Dr. Frank Dawson of Medstar Franklin Square, and I'm Ed Waldman for County Sports Zone.